My name is Joanne Pong. I'm a physical therapist, but specifically, I specialize in chronic pain. So the name of our clinic is Manual Physical Therapy. And the reason that it's called that is unlike regular or traditional physical therapists who do, ultrasound, electrical stim, all kinds of modalities, or even watch you do exercise, everything that we do is hands-on. So that's why it's called manual therapy. That's a form of treatment where everything is hands-on. And that's why you can probably see in our background, we don't even have weights. We have nothing but a chair for the patient and a chair for me and a bed. And you can see that there's a mirror in the background because whatever problems that we see, we just manually correct it and there should be a change. So that just gives you a little bit of a background about how we're different than a traditional therapist. So we specialize in one thing, and that one thing is when patients have been dealing with chronic pain for a long time, they have tried different types of treatment, and somehow they're still dealing with pain. Or sometimes people will say it seems to be spreading where there's more pain, not just on a back, but starting to feel problems in the shoulders, in the knees. So there's multiple joint problems. So the reason for that is when you're living in pain, you start to compensate. And the compensations will create a lopsided body. And so when you're dealing with a lopsided body, then your body is not capable of what you're asking it to do. So a good example or a good analogy of that is a car. So even if a car has a good engine, good brakes, but if the wheels are misaligned, it still cannot function properly, right? Yeah. So I find it very interesting that with us, even when we're lopsided or one shoulder is higher than the other, the hip is actually shifted over, we don't think it's significant at all. We think, oh, no one's perfect. But in fact, the car misalignment, when the body is lopsided, it cannot function properly. So I'm going to demonstrate, this is about golf, although with anybody it is helpful. But if you think about golf, I'm going to just tip it this way so I can back off a little bit. So when you are doing golf, I want you to try to do it. And mind you, we are not experts at golf. In fact, I don't even play golf, but I am a body expert. So I can translate what is required to play golf to what I see is a problem with the body. And this is so common sense that you are going to understand what we're going to show you. So there will be a Q&A at the end. So if you have any questions at all, I'm more than happy to answer any questions. So we are going to, an example of lopsidedness look like this. So for example, if you look at the body and let's say this shoulder is higher than the other. So if this is higher than the other, that's going in that direction. It might not be as clear as this. It can be so subtle. So one of the ways to find out if you put a pen on top and you're going to see that this would become more horizontal and then over here this becomes more slanted. So that is a good way to show that your rib cage, it's not your shoulder, it's actually your rib cage. Your rib cage is tilted. Sometimes you will notice that one breast seems to be slightly higher than the other. You're not made that way. It just means that if a body is tilted, then on the higher shoulder, the breast is going to be higher also. So another example of lopsidedness is, this is a really good one. So I'm going to raise you up and do that. So if you look at this gap right here, and you notice the difference on the other side, that is a smaller gap. This is a bigger gap. Essentially, what that means is her hip is shifted over. So if it is shifted over, you will see that it will reduce the gap. So in her case, she shifted over in that direction. And another one you're going to notice, because I am tipping her rib cage, sometimes you'll notice that one hand or one arm appears to be shorter than the other. It isn't. It just means, again, the rib cage is tipped. That can be leveled up. So I'm talking about the rib cage right now, but there's another one that's significant, and that is your pelvis. So a very good way to test the pelvis is go ahead and lay and sit down. So when you're seated, I want you to cross your leg like a man like this, go on. And I want you to pay attention to the height of the knee. Now you're going to switch over and test it on the other side. So go ahead and test on the other side. And this one, for example, if, hypothetically speaking, if this is actually slightly higher, like that, so you look at the height of the knee, and if that is higher, and then this one is lower, so you're looking at the height here, then that means that the pelvis, you can go ahead and then cross. So if the left knee is higher and the right is lower, I'm actually testing the fact that the pelvis is facing right. Because if she is going to face right, and go ahead and twist slightly to the right, you just like that. So now I'm making her just twist to the right, and I'm not saying that you are going to do this intentionally. This is if your body is twisted to the right. When she crosses her leg, now go ahead and cross your leg. I want you to look at the height of the knee. Now go and switch the other side. And you can see that it changes, right? I can't really see it, but ordinarily that should become higher, okay? There's an exception to the rule where it switches. I'm not gonna go into that. It just tells me what kind of problem coexists, if that is the case. So another one is I want you to stand up, and I'm going to tip that so you can see on the feet. So I want you to march in place, and good. So you can see how her, I don't know if she is facing that way, but when you go like this, let's say the right foot is slightly out, and then the left foot is straighter. You will see this. This is very, very common. I'm going to explain this first, and then we'll tie it to the how to swing when you're playing golf and how this ties into that. So when your foot looks like this, where the right foot is the one that's turned out, what that means is the pelvis is actually facing right. Now, if she switches, now go ahead and switch. That means that the pelvis is facing left. So how is that significant to playing golf? So if your body is neutral, that means your feet placement are symmetrical. And when I mean symmetrical, it doesn't mean when you Google it, they will say your feet have to be completely straight. I disagree with that. It has to be symmetrical, and slightly out is okay. In fact, I like that better. Again, I'm not going to go into why, but that just relaxes both your internal and external rotators of the hip. So when you are in this position, now I want you to pretend that you're swinging a golf club. Go ahead. Start with a backswing. So go back. Good. All right. So your pelvis is facing right, and then go do the follow through. There you go. So that is ideally, and Luan, don't judge us. We just need to know the basics. So go ahead and go back to neutral. Now imagine if her pelvis is actually facing right. So I want you to move your feet slightly so your right foot is turned out. So you can see how her foot is slightly out, right? And so in that position, that means that her pelvis is actually facing right. Now, from there, you can just imagine that because her starting point is facing right, it will be easy to do the backswing because she's already there, right? So this would be a good range of motion. However, when she does the follow through, you can see how she lost her balance. That's a very good example because her pelvis was facing the wrong way. It prevents her from doing what the body wants to do. So she is going to stop right here, and it's going to make the ball go inconsistently. It's going to be more maybe right of the hole, right? Because she can't turn her body so that the belt buckle is facing the hole. So that's what we mean by, is the body capable of what you are trying to do? Now we're going to flip it so that, let's say the left foot is pointing out. So I'm going to point that out again. Left foot is pointing out, and then the right foot is straighter. And you are going to notice this. If you look around at people, go to Publix or go to the golf course, you're going to notice these things. Essentially, that means that the pelvis is facing left, right? So now in this position, it will be difficult for her to have a good backswing because she's facing left. So she's going to have a tough time going in this direction. That is why people's backs are going to hurt. That's why the hip or the knee is going to hurt. You can see how she's struggling with this. Now she can go follow through, but then now she got carried away. So now the ball is going to go off track. So that gives you an idea of how critical it is to have a neutral body. Now, one other thing is, in addition to this, one of the things that people don't realize is that there's actually a turn in the body. It's like that. And a really good way of looking at you, whether you have a turn, is you're going to notice that one hand will be slightly behind and then the other one is slightly in front when your arms are hanging down. So people don't realize they're actually going like that. So that is telling you that you are turned. Another way of looking at it is, if you're turned that way, I want you to look down on your breast and you're going to notice that one is right. So you hear people who say, my one breast is always bigger than the other. It typically isn't. What that means is, if your body is turned, you will notice that one will look bigger than the other. So these are just, I want you to be aware that these are happening. The other thing I'm going to point out, although we're not going to discuss it that long, you're going to notice maybe in your pictures that you tend to like tipping. And it's usually not a straight, it's not usually a straight tip. It's more like a little bit of an angle. So in the camera, you're going that way consistently. Or one of the ways to test it is, I want you to tilt your head to one direction, and then I want you to tilt your head in a different direction, in the opposite direction. And you're going to notice that you have a preference. That tells us a lot. All right, one last test that I want you guys to do, which is to stand on one leg. So I want you to stand on one leg. Yeah, move forward, stand on one leg, and then stand on the other leg. Get out of your way. All right, now stand on the other leg. So in her case, you notice that she stands on her left leg. She actually tips more. You see the body is leaning more. Now go to the other side, and that one, she's not leaning so much. Now, none of them is right. The key is symmetrical. So it's not that you shouldn't lean, but the degree of lean on one side should be the same as the other. Now, why is that significant? When you are walking, you literally have to stand on one leg to advance the other leg. So if in her case, she has an extra lean to the left, that actually means that when she's walking, she is going to somewhat lean slightly more to the left. Now, why is that significant? If you are consistently going to tip to that side, that means you're going to shorten these muscles. So eventually that's going to lead to a back problem, a hip problem, or even a knee problem. But another thing I'm going to point out, even though this is not about golf, is you hear so much of people with IT band problem, right? So that's usually, or bursitis for that matter. So they have pain right here and they can't lay on that side where they're sleeping. Well, imagine if your body is actually tipped in that direction. So you have a hip shift to the right. If you have a hip shift to the right, you can see that now this is overstretched and that one is tight. But because it feels tight, people are going to think that it needs to be stretched. So people tend to do IT band stretching on somebody who looks like this, not realizing that they are making the problem worse. So somebody like this, if the pain is on this side, it seems counterintuitive, but really and truly, it is this side that needs to be stretched, because when that is stretched, the hip will go back into a more neutral position. So I hope that that is giving you some awareness of what this is all about, which is really the treatment that we do is called body recalibration method. It's very self-explanatory. If the body becomes symmetrical, you will be capable of doing the things that you love, including golf. So now that you're aware of all these, there's actually 8 different things that we correct, but I'm just pointing out a few, right? So one is the rib cage tilt, there is the rotation, there is a pelvic rotation or instability. That's when you stand on one leg. So those are just 4 out of different things that we do. So now the question is, so you're off, what are you going to do about it? Right? Now, I'm really hoping that you can follow me along, and I know that your cameras are not on. If you don't mind, when we're recording this, you won't be part of it. But if you don't mind turning it on, I will be able to check if you're doing it right. But I would really like you to, so what I want you to do is I'm going to give her instructions on what exercise to do. It may seem counterintuitive, so I'm going to explain a little bit what it's about. It is fascial recalibration. So there are 2 different types of things that we recalibrate. One is the fascia and one is the muscle. So today is about giving you instructions on how to recalibrate your fascia. So let's say you are twisting to the right. So your knees are straight and you twist to the right and then you twist to the left. I want you to do it right now, if you don't mind. And I want you to figure out which direction is tighter. Now, whichever way, so for example, in your case, which one is tighter, Emily? So this one is tighter to the left. When we're talking fascia, what that means is her t-shirt or the covering is actually twisted to the left. That's what it means. So a good example of what fascia is, for those people who don't know what that is if you look at a piece of steak, you see marbling. That's fascia. And it's like your skin, it connects you from head to toe. So imagine that your skin is twisted. So it can twist in different directions. So again, in her case, if it is hard for her to twist to the left, that means that her fascia is actually twisted to the left. What do most people do? They will stretch towards the tight side. So that's good with muscle, but when it comes to fascial untwisting, if you twist towards the tight side, you're actually going to twist it even more. So what you need to do is you need to choose the easy side. So in her case, she said that she was tight going in this direction, and so I want her to twist to the easy side. So I want you guys to do it. So twist to the easy side. Now, there are 2 different ways of trying to figure out. Well, let me finish this first because I don't want you to mess it up. So once you've chosen the easy side or the less painful side, you are going to stay there for just 20 seconds. And one thing, if you can come away with something that is very, very helpful, less is more. I don't want you to be aggressive with stretching, because when you're aggressive with stretching, that means you're stretching muscles. We're not stretching muscles, we're just moving the fascia. 2 different problems or 2 different things. So again, start over. We're gonna twist to the easy side. So I want you guys to twist to the easy side. You're gonna hold it for 20 seconds. And we're gonna go through this. All right, and then you go back to center. Now do it again. Same side, you do not switch. Gentle, please. Out of curiosity, remember how you've chosen the easy side. I want you to reassess one time. Don't stay there too long. I want you to reassess towards the good side or the bad side. And I want you to know, is there a 5%? So there should be a 5% change for the better. Now, I don't expect it to go away. It gets worse, that means you chose the wrong side. If there is 0 change, that means it's not just a fascia that's twisted, it's actually your muscles. So that is a whole different type, that's a muscle recalibration. But again, we're sticking to this. So now you have an understanding of what we're trying to do. The same applies for all the exercises. But before we do that, I want you to try this. I want you to pretend that you are swinging a golf club. So go ahead and swing. And I want you to remember where it pulls, where it's tight. Because you're going to compare this later on. So just do one and pay attention to where it pulls, and then take a mental note of that. Because at the end of the session, we're going to review it. You're going to compare how it feels now versus later on. So now we've done one exercise. Now we're going to do another one. And that one is you are going to compare. Go ahead and do this. So if you have a chair, it would be ideal if you have a chair. And what you're going to do is hold on to the chair. If there's none nearby, you can hold on to the wall, but lower it. And you are going to bring your chest towards your knee. Go ahead and bring your chest towards your knee and allow the hips to slightly go back if needed. Keep your knees straight. Pay attention to that. I'm warning you, this is going to feel like going to the eye doctor. You're going to continually compare this to the opposite. And then now you're going to stand at arm's length and you're going to push your hips forward. Now you decide which one is easier. Remember, we're after what's easy. So it's either you bend forward or you go back. Whichever direction is the easier one is what you're going to do first. All right, so in your case, which one's easier? This one. So now that she shows that this is easier for her, so she is going to hold that position again gently, and she's going to hold that position for 20 seconds. So let's go through that. So hold it for 20 seconds. And again, I cannot emphasize less is more. Trust me on this. That's the way to go. And then you're going to, this is your second one. So now we're doing another 20 seconds. And so the question is, when you review this, did it change by 5%? Thumbs up if it did, thumbs down if it didn't. I'm looking for 5%. All right. So now that you have done that, you're not even going to do this yet. There is a process to it. The way I've structured this, it's all with golf in mind. So now I want you to remember the feeling of the bending down. So go ahead and, so I want you to bend down just briefly, and I want you to remember how that feels like. Now stand up. And now we're gonna go back to that later, but I want you to stand in front of the mirror. And what I'd like you to do is take a side step. And then a comfortable side step, but not too small either, whatever your body's capable of. And then you're gonna stand on both legs. So you're forming this V shape. And you're gonna feel some tightness somewhere. Sometimes you actually feel discomfort here. So what you're going to do is compare stepping to the right and then stepping to the left. So I'm going to get out of your way. So that's one. Now go to the other side. And two, which one is easier for you? Going to the right. In your case, whichever direction is easier, that's what you're going to do. So you're going to take a side step and you're literally just standing still, doing nothing. Go to the easier side, stay there for 20 seconds. When you're finished with that, you're going to step back in and then you're going to do it. So you did 20. You're doing the second one of 20. Go ahead and take the side step, 20 seconds. You're done. So out of curiosity, I want you to do this as a retest. Remember how I asked you to bend forward. I want you to do it briefly. I want to know, is there a 5% change? Bring your chest down. And typically there should be a change. All right. And you can stand up. So I can't really see you quite well, but if you think that there is a change, thumbs up. And if there is no change, thumbs down. All right. Very good. So this is more just making you aware of what's happening. All right. So now we're going to move on to the next. Now, if you think about it, when you do the follow through, sometimes there's a shoulder problem. It's just stiff and it just doesn't go anywhere. So I want you to rest your hand on the opposite shoulder, but make sure that the shoulder, so the elbow is level with shoulder. So if you go sideways, There it is. So you don't want to drop that. So you're gonna go up. All right. And from there, I want you to twist towards the left. So you're gonna twist to away or not on the elbow that's raised, on the opposite side. So you're gonna twist that way. That's one. Put your arm down, and then you're gonna do the opposite and then twist this way. One is easier, is again what you're gonna do first. So because that's easier for her, she's gonna twist. And the rule is always 20 seconds times 2. All right, so go ahead, 20 seconds, come back and do it again, 20 seconds. And let's reassess to see if there is a 5% change. And then now twist to the other side. Is there a change?
Yeah.
Very good. Now you notice I'm not even asking you to stretch the other side, right? So the question is, why am I not asking you to stretch the other side? So if your fascia direction, so if the fascia is twisted in this direction, I'm trying to untwist it by choosing to do the easy side. So I'm going to do the easy side, right? And I'm going to do it again. And then once you do twice, you leave it alone. Because if you're going to go this way, guess what? You're just going to twist it back. Now, in our therapy with our patients, once the patients are symmetrical, we change it a little bit because at that point, it's okay to go on the bad side as well. But trust me on this, just do it on the easy side twice, and you can just retest it and see if it made a difference. All right, so now we're almost done. So now we are going to, I want you to sit right here. So go ahead and sit here, and I want you to cross your leg like a man. So I'm gonna tip it a little bit so you can see. So cross your leg like that. So it's not the feminine way of crossing, it is with the ankle above the opposite knee. And then keeping your back straight and your head straight, I want you to lean forward, just like that. You're gonna feel some stretch. And now you are going to switch to the other side and tell me which one is easier, and then lean forward, which one's easier. So go ahead and do the easier one, and then lean forward 20 seconds times 2. Okay. Then put your leg down completely and do it again. So please don't get tempted to, instead of saying 20 seconds times 2, please don't be tempted to say, oh, I'm just gonna do it 40 seconds. That does not work as well. I don't know if you picked up on it, but the second time is always slightly easier than the first one. That's something about the fascia and resetting it. So it's very critical. Now, one thing I want to point out, and just do a retest first, and then lean forward, keep your back straight. Is there a difference?
Mhm.
So you'll notice that there is a difference. And if it doesn't, if you don't have a difference, that means the muscles are surely the problem. But it's still good to do this. You just don't feel I'm twisting, but it's still working. All right, so one other thing is I want you to raise your arm. Did we do the side step, side bend already? No. So stand up. So you're actually going to do it standing. And with your arm straight, I want the opposite one, the one that's hanging here, I want it to reach down towards the knee. And again, less is more, so just gentle. But please do not do this. You are going to break the pattern. So you are going to go that way, yeah, and then do the other way and tell me which one is easier. So again, same concept, do the easier one, 20 seconds. And then put your arm down, and then repeat. Raise your arm up, and then same direction. All right, retest. Make a difference.
Mhm.
Now, so you can see there are other ways of doing this, but I wanted to do this because it's easier. You can literally do this in a golf course. If you want to do this, ideally, you should do it first thing in the morning. But before the game, you can also do this, and at the end, you can also do it. There is one that we do lying down, but I want to modify it and do it standing. If you have a shoulder problem, I don't recommend this. At least this should be done lying down. But with your arm out at shoulder level, I want you, and without twisting the body, move the arm back. And please don't be tempted to drop it down. So make sure it's level and then move it back, feel the stretch. Now go to the other one and feel the stretch. And then you tell me which one is easier. The palm should be facing front. That one's easier. So go ahead and do that. Now with this particular one, I actually want you to bounce it gently. Because if you don't, your arm's gonna fatigue. So just do it gently. You don't go like this. You just go to the end and just gently bounce it 20 times. Put your arm down, do it again 20 times. Note to patients that this is when you feel like 20 seconds is a long time. Now retest. Oh, you don't have to do it. Did it make a difference?
It did, yeah.
Yes. So we're done. That's the exercise. So you notice we did probably 7, I lost track of it, something like that. So it's really not a whole lot of exercise. And so now that you've done that, I want you to pretend that you were swinging and see if, so what are your thoughts? Is it making a difference for you? Do you notice a difference? How about Luann? So typically you should notice a difference. So I'm going to move this. You want to unplug this and then we're just going to talk. And so go ahead and plug it in there just in case. So we're just going to have, so I'm going to tell you what that was about. So it's like what just happened there, right? So I'm going to give someone a credit for an easier way of explaining it. And it was one of my patients. I was trying to talk about untwisting the fascia, and this was her understanding, which I'm sure a lot of people can relate. So imagine that you are making a bed, right? And you have this bedspread, and you throw the bedspread on top of the bed, and you are going to notice these wrinkles. And so in order to flatten the bed, you go around the bed, and depending on the direction, the crease, you either tug harder, you tug gentler. That is essentially what you did. Okay. Or another way of looking at it is imagine that you are wearing a t-shirt and a pair of yoga pants that's twisted, and you go about your day functioning like that. Can you imagine how uncomfortable that is? So what you did was you just untwisted it. And so now you notice a difference, essentially what it is. Hold on. There we go. So anyway, that is pretty much what fascial recalibration is. One other thing to point out is you notice one exercise takes 1 minute. You assess right and left, and then you do 20 seconds times 2. So this essentially one exercise is 1 minute, literally 2 repetitions, right? And you do what, 7, 8 times? I did not count how many those were, but that means you are doing this for 8 to 10 minutes to be able to function better for the rest of the day. So that is wonderful, Monique, that you can feel the change in your lower body. Essentially what you did there, so Monique said, I felt the change in my lower body. This is transformational. Now, body recalibration, if we're doing muscle, you actually change permanently, really and truly, because it changes the way you function. But with fascia, right? So you've untwisted yourself, but you still have muscles that are tight. So that means eventually those tight muscles are going to twist again. So that's why this type of treatment, you have to continually do this. Now, when is the best time to do this? It's first thing in the morning. My patients know when I say I mean first thing in the morning, not after having coffee, not after taking a shower, but literally you wake up, if you have to go to the bathroom, and then do it. Or if you don't have to go to the bathroom, do it right then and there. 10 minutes of your life will make a huge difference for the rest of the day. Now, I'm going to point out something that most of us do. We do our exercise when it's convenient. I'm busy in the morning. I got to do this. I got to do that. And I'm just going to do it in the afternoon. Well, guess what? If you're going to wait till the afternoon, from morning to afternoon, you have been functioning with the twisted t-shirt and the twisted pair of pants. So you've been dysfunctional the entire time. And then at the end of the day, you're going to do it. But then after you do it, it's time to go to bed anyway. So your benefit is very limited. So the other thing I wanted to tell you is give this 2 weeks. Make a commitment of doing this first thing in the morning and just do it for 2 weeks every day. Don't skip it. And then at the end of the 2 weeks, I challenge you if you want to stop, because you will notice a difference. So now I would like to open it for any questions. If you have any questions, I'd be happy to answer them. So Monique has a lower back problem. Have you got any questions? I think Luann might have unmuted herself. Do you have questions, Luann?
I have extension problems with my right shoulder.
I missed the first part of that. So you said something about your shoulder?
I have extension problems with my right shoulder.
So can you stand up and show me?
Going back.
So
Like that.
going back is difficult, right?
Yes.
I want you to stand square in front of the camera because I want to check this out. The angle is kind of different, but so knowing that it's hard to go back, I want you to test it again. Same concept. I want you to push twisting. So push your arm back without twisting. Now do the other side. Is there a difference? Move it back. Yeah. So move it back. And because that's the movement that you're struggling with.
Correct.
So go ahead and choose the easy side. So go ahead and do it 20 seconds times 2. Monique, bear with me. This is another example that you can do whatever problem you have. You just do the mirror image of it. And I want you to retest it and tell me if there's a 5% change. No right or wrong answer. Is there a difference?
It goes easier.
You got it. You just untwisted that part. So in other words, it doesn't have to be the specific exercises that I'm giving you. By the way, the question of why am I giving you those specific exercises? If you Google it, you won't find those types of exercises. Some of them are yoga. Some of them I've modified it from yoga. If you have not heard of myofascial lines, mean that in our body, there are muscles that overlap and there's certain patterns. There's 8 different lines, and I just kept those in mind so that it allows you to get recalibrated better. So that was very specific. But in your case, whatever, for example, if it hurts here, then just do the other side. And then you do it 20 seconds times 2, and that should make a difference. But because you have an issue, I wasn't expecting you sharing this, but we're going to do this. And then I will talk to Monique too. So I want you to put your hands here, both of you, or 3. Hi, Susan. So I want you to push your elbow back, 1, and then do the other one, 2. Now go and reach behind your back, 3 and 4. Tell me which one is the hardest and which one is the easiest.
Mine is the right upper back.
What were you doing that was hardest? Which one? Reaching, that one is the hardest. Which one was the easiest?
And both on this side.
So not this one, right?
They're
Not
both.
that one. It's the under one. So I want you to do the opposite. So you're always choosing the easy side. So go ahead and choose the easy side. And in your particular case, Monique, whatever is the easier one is what you're going to do. You're going to do it 20 seconds, gentle stretch, and then put your arms down and do it again. And then whatever was the hardest one to do, I want you to do it. The hardest movement. And tell me, is there a 5% change?
Yes.
Very good. Great. Now, so I'm glad that you brought that up because I got a chance to show you that. All right, Monique, how about you?
Does it last? Or
You do it every day to keep untwisting, but remember, it's only 8 to 10 minutes of your life.
Yeah.
But here's the thing. If you want, there's one thing where you will notice that consistently one side is tight. That is where muscle recalibration comes in. I cannot teach you that because that requires some specific skills. Now, if you are remotely curious about what that's about, I am in appreciation for you showing up. I am going to give you a free treatment if you're interested. And it's either a free treatment of what the muscle is or what we call the entire body holistic body recalibration. We can do that. We can talk more about that. We can call you and we'd love to talk specifically about your case. Because those things, you don't have to live with them. you can actually recalibrate your body, not just the fascia, but also the muscles. And that is essentially what we do. So you notice it didn't matter what your problem is. Monique has a back problem and Luann's got a shoulder problem, and both benefited from the exercise.
Yeah.
The reason for that is it is a holistic treatment. I find it very interesting that when we have a body part that's hurting, we just focus on that. Our body is connected. And so we have to address the whole body. Again, just like I said, do you have a misaligned wheel or do you have an aligned wheel so that the car walks, or wheels so that the car drives properly? So I hope that gives you some clarity.
When, can I ask you a question?
Yes, of course.
When you did the test with the model that it was the sciatica, that you cannot sleep on that side because that's too stretch, you said?
The bursitis.
Right, what side is it?
So with the
How do you stretch that?
so you do the other side. So if your hip is shifted this way, you have to find out if your hip is shifted that way, that this is overstretched.
So
This
then
is
go to the other side.
So even though the pain is here, you have to stretch this one.
And it makes sense because my right knee is the one that is being weak. So I probably standing on the other hip, protecting
Yes.
the knee.
You
So
are
that's
going to
when-
notice, if you really watch yourself closely in front of the mirror, you're going to notice these nuances and there's deviations in your body. Don't ignore them. I hear people say, well, no one's perfect. Well, that is why you're not functioning properly. Now imagine this. I'm going to give you one last thing, but imagine if your hip is shifted to the right, and then your hips are actually facing that way. And then this one is also facing to the right. I'm exaggerating, of course, right? So let's say you think this is neutral, but you're actually lopsided. And you're like, I don't understand why it's hard to walk, right? So if you keep that in mind, you're going to notice that there is actually a solution to the pain. Don't ever believe that the older we get, the more pain we have. The reason you have pain is because your body became lopsided, because when you turn 40s and 50s, you lose flexibility. And so your old habits get stamped on your body. And
how do we do the treatment with you?
you could call me. So the first thing that we do is we do the fascial recalibration, but we do it from head to toe. I'm just giving you like a general. And then after that, how you notice that there were parts that are tight, we interpret that in muscle. So for example, if this is tight and then this is easy, we know that the serratus anterior, it's a very specific muscle, that's the one that's problematic. If the shoulder is lower like that, I know that on the lower shoulder, your pecs and your lats are going to be tight. And here, it's going to be the upper traps. So based on how the body looks like, we can release specific muscles different on the right than on the left. So it's like saying that you're a Rubik's Cube that's misaligned, and one muscle at a time, we will move you in order to realign you or recalibrate you.